being an orthopedic doctor, surgeon, to doing a master's in machine learning, then doing an MBA from, of course, MIT, and now setting up a company in India.
You get the best possible treatment for sickness now, for cancer, for heart disease, everything. But the thinking and then the approach now is like, why should we even wait for someone to fall sick?
So how does that actually work? How do you go and predict what my health condition? So is it encoded in my genes, in my lifestyle?
It's called, systems medicine framework. Our genes are getting exposed to these toxins and then there is a change of gene. Everyone knows that smoking causes cancer. But do all the people who smoke get cancer? Because there is nothing like if you smoke you will get cancer. It's like poison. Nobody will touch it.
Interestingly, at Rishihood, we have a mandatory course that all undergraduate students have to go is in the systems thinking.
Very happy and amazed to know that you are teaching systems thinking, which I had to go to MIT to learn.
What are those problem statements that they're working on, and where can our students think that they can get placed if they take up a program like this?
This kind of information is being churned at a scale across the world. So it's going to be, a big change here. In US, very sick 5% people consume nearly 50% of healthcare resources.
Technology exists. We can do so much better to improve people's lives. It's just that we need people who can work on these problem statements. Namaste, Dr. Vishnu Vardhan.
Yeah.
Welcome to Rishihood.
Yeah.
We have heard about each other, met in different places, but it's always a pleasure to get such guests on campus because we get to discuss about what are the emerging things happening at the cutting edge of industry. And you have had an amazing educational background, being an orthopedic doctor, surgeon, to doing a master's in machine learning, then doing an MBA from, of course, MIT, and now setting up a company in India. So on Gen AI as well as computational biology, synthetic biology. So I want to understand from you and for our audience, what do you see is the frontier of medical science? What's happening there? Because we don't get as much exposed to that because our education gets split very early into technology or into medical or into other arts, commerce. So what's happening at the intersection of technology and medicine, if you could tell us a bit about that?
When it comes to healthcare, it has always been very traditional. Since last 100 years, healthcare has really, evolved into a very scientific endeavor. Before that, people were being treated using very traditional methods. So there was no way we could tell a right method from a wrong method because there was not much science involved. But later it evolved into a lot of technology, but it was all addressing the sickness, right? Like you get the best possible treatment for sickness now, for cancer, for heart disease, everything. But the thinking and then the approach now is like, why should we even wait for someone to fall sick? Like I have stage 4 cancer, I get the top end treatment, they do radiotherapy, or I have like heart block, I will put a stent there. That's all there. It's all needed. But can we tackle this even before it develops? And for that, you need a different approach. You need to bring in technology there rather than pure clinical skills, because you can only understand that when you use technology. If you're not sick, how would a clinician even understand your what is happening inside? So for that's where the whole healthcare is moving, where it will be a mixture of health and technology. So I'm not talking about disease, I'm talking about health and technology. So future doctors would be people who will know both sides of the spectrum, where they're also like, in fact, as I'm talking now, we are talking to Maharashtra University of Health Sciences, where we are introducing technology, machine learning, these kind of courses into medical curriculum itself. So that's where things are moving. And with more and more technology becoming mainstream, this artificial, division between biology, people can't understand maths, or they should not study math, or math people don't need biology, is now being broken. Because biology is more math now. Like you need modeling, you need to understand the systems approach of biology. All that needs both. People who can both understand biology or math, biology and computer science, biology and coding are going to be like very, very important for this.
Very interesting. So you're saying we have created artificial divisions which you see are going to break. Inevitably, they have to get broken, right? But just going a little bit back, you are saying you could predict. There's a way to predict what would happen. I mean,
Yeah.
possibly I'm developing a heart blockage now,
Hmm.
and I will only realize it much later. The current medicine is trained, okay, once I get
Yeah.
my heart attack, then
Yeah.
possibly somebody.
Yeah.
So how does that actually work? How do you go and predict
Hmm.
what my health condition? So is it encoded in my genes, in my lifestyle?
So I will
Yeah.
give you a simple framework,
Yeah.
like how it works. It's called, systems medicine framework. See, currently every human on earth is exposed to three things. One is environment. You
Yeah.
are in Delhi, I am in Bangalore, somebody is in some other place. But there are environmental toxins, pollutants, viruses, so many things. Like in US, we see a lot of molds, which are fungus, because mostly they stay indoors, everything is air conditioned. So these are the specific things which everyone is getting exposed to, which is very personalized and where you live and what is it. And second thing is lifestyle itself. What do you eat? How much do you exercise? What kind of food you eat? What is your work? Everything.
Yeah.
The third is trauma. Trauma is like how much stress you undergo, because see, modern lifestyle is nothing but trauma. Like nobody is relaxed in the uni also. So, and other traumas we face are this exposure to a lot of technology, mobiles, blue light, which is artificial light. Artificial light itself is a trauma because now we don't get exposed much to the sunlight. So all these three things are happening in various proportions to each person's life. And this is not something which is, just there. So it's interacting with your body and your body is reacting to it. This is how we see that prevalence of diseases are increasing. Like US, I will tell you, stats mostly come from US because they're the most studied population. In 60s, there was only 3% obesity rate. Like out of 100 people, only 3 were obese. Now it's nearly 40%. And if you see the overall consumption of food, the calorie intake is decreased compared to people in 60s. So when you're eating less, but still you're becoming obese. That's a very contradictory thing that's happening. Even in India, we see a lot of people are becoming diabetic at very young age. So all this is happening at the genes level, like our genes are getting exposed to these toxins and then there is a change of genes. But this change of genes, which is called epigenetics, can be really studied very well ahead of when it becomes a disease. Today, we study people and say, okay, your sugar levels are increased, so you're diabetic. But at the gene level, at the epigenetic level, it would have happened much more earlier. Okay. And the precision comes from the fact that, can I tell that person, this is the problem which is causing this change, stop this. Like example, I will tell one simple example of smoking and cancer. Everyone knows that smoking causes cancer. But do all the people who smoke get cancer? No. That's what makes people very difficult to prevent smoking. Like all cigarettes, they're right, smoking causes cancer, nobody cares, because they'll think, okay, I'm not the person who will get it, maybe the other guy got it. Because there is nothing like, if you smoke you will get cancer. It's like poison, nobody will touch it. But only few people get it. But if you understand epigenetics, I can very well predict before you get cancer that your gene is changing, and if you quit smoking, it will stop. So that's very precision treatment. There's a precision advice rather than a generic advice that smoking causes cancer, which applies to everyone but not to me. So that's where the healthcare is moving, where I can see your lifestyle, see the changes in the genes, and then tell you like these are 4 things which you need to avoid. This is how you do it. So you prevent a lot of diseases. Like that's what longevity is being talked about. People are talking about living for more number of years. We can do this, but here it's very complex. You need technology, math, biology, everything to come together to go to that level.
It's very interesting because you're taking a systems view, not just within the human body, but you're integrating the environment, lifestyle, everything into it. Our current education is not addressing it that way, right? You look at subjects, first of all, in very individual ways. There's no interaction between the courses as well. Overall, the program itself is looking at a very limited human physiology and trying to understand us. So you see in some ways that is the curriculum getting outdated with the way the world is progressing? I mean, when you look at the academic curriculum in various...
The whole MBBS curriculum is outdated because it's a very bold statement I am giving. I'll tell you. See, artificially we have divided humans into various organs and specialities. That is for our own, simplicity, rather than how it works in real life. Body doesn't recognize between liver, kidney, and heart. Everything is connected. if liver gets affected, then virtually, you will see heart getting affected, you will see brain getting affected. People say, okay, it's depression. Depression is not just happening at the brain level, it's happening across. So and it's not even like it's confined inside your body, outside, so this is super systems approach, right? So to study this, you can't artificially study only human physiology on one side, and then climate change, we are doing a lot of systems work. Like we are studying like how human is emitting carbon, how carbon is going and affecting there, and why it is causing rains, excessive rain. Like Delhi got whole month's rain in like 2 days. Now, which kind of infrastructure can withstand that? And this is happening very frequently, right? Kerala, there was a big land. All this is a systems problem. Same thing is happening with human bodies, but we don't study it, right? We don't study that way. We are not looking that way. And ultimately, human body is the most important thing for whole humanity to save. And you have to look at it from that perspective.
So in one way, it sounds that, okay, what we have been doing so far is a very siloed or it's a mechanistic view of the world, right? The Western thinking, as it's called, right? You look at things as a machines and individual parts, but you're taking a systems approach. Interestingly, at Rishihood, we have a mandatory course that all undergraduate students have to go is in the systems thinking. So you'll have to see how everything is integrated because you try to solve a big problem, you need to understand it's integrated, right? And same for the human body as well, as you're saying. But at the same time, it sounds very daunting because how do we structure a curriculum around this then, right? I mean, do I have to teach everything under the sun to make and I'm sure that you have thought about this. So how do we structure something which is at the intersection of computation, intersection of biology, and the other things that you talked about, climate change? So how does one go about designing a program like this?
I'm a doctor. I was orthopedic surgeon, and I used to operate on orthopedic patients, trauma and all that stuff. When I went to MIT, we had a course called System Dynamics. In fact, this whole system thinking came from MIT, and the professor who designed this System Dynamics course teaches climate change course. So he taught us this, and it was mind blowing for me because that's when I understood, like, we can't think any problem from perspective it's going to be linear. This happens and this is the problem. So if I solve this, it's end of it. It will lead to some other things. So many times that's how you see, even the good things lead to bad consequences slowly. Like sweet itself is a very good, right? Like it's a tasty. Otherwise, why would humans love sweet? But you eat more sweet, then it causes problem. And so how do we design curriculum? So, and I'm really, very happy and amazed to know that you are teaching systems thinking, which I had to go to MIT to learn. Imagine somebody getting taught systems thinking at undergraduate level, which I was not taught. In MBBS, there is nothing called systems thinking. We are taught very linear. This is the disease, this is the pathology, this is the medicine, this is the treatment, and done. We never think, okay, all this later will lead to some other problem. Like the whole, there is a big problem, obesity problem, and there is a drug also for that. It's called Ozempic. It's become a blockbuster drug. Hollywood, movie stars, celebrities, everyone eating it. Now, what it does is, it releases a hormone called GLP, which makes you feel that, I'm full. Even without eating, it will make you feel full. It's like, I've already eaten. Your brain is thinking like that. That's why you reduce your weight, because you're reducing the intake. But see, that kind of solution is how this kind of thinking will take you. You are eating, you're not stopping, from eating the bad processed food and all that. You are just artificially creating in your brain. But instead of that, if people know that, all this right eating is the right way, so you don't need medicine to. So the systems thinking will bring that up. If you are linear thinking, so how do we design a course which will work from that perspective to just break this artificial barrier between, biology and technology, engineering and math, computers and doctors? Virtually a course which can, take this framework like, okay, everything is not linear. There are consequences for everything you do. So things from that perspective, and then see, for any systems thinking, there are three major, frameworks. You need to know math, because that's how you model and then think of. and you need to know, okay, the domain knowledge. Say, if I'm thinking about human health, it's about biology, right?
Yeah.
And how do you model both using this, and then learn about the interactions that happen? It's going to be, very good framework, and that's what mostly, bioinformatics is about. Bioinformatics with systems medicine or systems biology, we call it. It's a big thing that's happening now. More and more companies, more and more medicine, healthcare will be done through this. And by the way, healthcare is the biggest domain in the world. 20% of world's GDP goes to healthcare. US itself is a $4 trillion healthcare, and it's bigger than India's GDP.
Yeah.
So it's a big domain, and everyone is now looking at it. All top companies in the world are behind health. Google, Amazon, Microsoft, Nvidia, everyone wants to tackle the healthcare problem using technology.
Yeah, because we have seen technology impacting almost every other domain of our daily life, right? I mean, we know it's getting into law, we know it's getting into psychology, we know it's getting into many other things, but now you're saying the healthcare is the last big frontier, that is 20% of world's GDPs, I heard you say, is into healthcare, and technology is going to disrupt that. What would be possible career options? Because typically in India, I know it's also a research domain, but many of them would want to build startups out of this or work for very challenging problems. So you took some very big names of companies. What are those problem statements that they're working on, and where can our students think that they can get placed if they take up a program like this?
Yeah. So you are gathering a lot of information now.
Yeah.
So much from, like, this watch itself is giving so much of health information. This kind of information is being churned at a scale across the world, and who is going to develop, insights out of it and then make you, do that? So that's the whole industry which everyone wants to be in. And now I'm only talking about a very superficial thing. Watch will give what? Max, it give how much I have walked, what is my heart rate, 3-4 things. Inside the body, if you go, there is something called omics, where we study your genes, your gut microbiome, all the little proteins which are generated in the body. It can all be done at a scale. You'll not believe, I think Meta has invested $1 billion in this research in 4 top universities in the world, where they want to say, like, how can I study a live human, like what is happening inside? Today, we study environment, we study weather minute to minute, second to second, but can we study humans like that? So that's a lot of information.
Yeah.
It's a bioinformation. It's not just pure, like, weather is what? I get pressure, temperature. And in humans, you get biological information live. So that's what, mostly bioinformatics is, getting information live and then studying at a scale. So it is going to be the place where you will generate newer drugs, newer biomarkers, newer methods of treatment. And for that, you need, people who can understand both mathematical modeling, computer science, and biology. And that's where a lot of jobs are going to be generated. And it's a very, specialized thing. A biologist who doesn't know this can't solve this problem, or a computer scientist or a computer engineer who doesn't know biology can't solve this problem. A lot of jobs, and already there is a requirement. I am seeing the market. We have machines to do all this, study genes and all. We don't have many people to interpret them, churn the information. That's holding up the industry also. So I see, to unplug that bottleneck, we need to tackle it from the technology level. Currently, the tech computing has improved. Even going forward, we'll get quantum computing. So it's going to be, a big change here.
Okay. You're saying many things are falling in place,
Yeah.
but there's a talent crunch in some ways, right? If you can get the right people, a lot of such solutions could be unlocked. And anything that we think at Rishihood, we just don't think because it's a market trend or something. I believe it's just a national need for it as well, because the healthcare costs at the tertiary level go up a lot, right? Just example of a heart block that you mentioned. If I have to get a bypass done, it's going to be so many tens of lakhs possibly, right? But if somebody could tell me much earlier that this is what's going to happen to you 10 years down the line, possibly the healthcare costs also will come down. Is that a right estimate that I am saying, that if somebody says this is what's your tendency, start having this early on in terms of diet, in terms of maybe something else. Am I right? Is that a right estimate that I'm saying?
Yeah, it's exactly. See, I will tell an extreme example. There is a problem called Wilson's disease. It's seen in nearly 1% of Indian kids born. So it leads to liver failure at about 8 years, 7 years of age. Because what happens in them is like copper gets accumulated in the liver, and there is a drug for that, which can be given. It costs like about 3,000 rupees to give it. But if you have to identify early, once a liver failure sets in, you can't. It doesn't work. Then you need the other treatments. Like you see a lot of kids having this liver problem and given liver transplant and all. It's a very expensive thing. So much mortality is there. But if we can identify these people in the day one using a very simple gene test, which will not even cost like few hundreds or maybe rupee. But we don't do it for everyone, right? So that's a problem. So because we don't do it for everyone, we'll not know till they get this problem. So these are things which will prevent a lot of pain and cost all of, because setting up liver centers for pediatrics will take hundreds of crores of investment. Each liver transplant is nearly 30-40 lakhs of rupees. Who can afford it? If you see keto or Milano, these things where most of the problems are kids having liver problem, kids having liver this cancer, that. So it's so painful, right? Like even after all the great treatment and spending money, they're never going to be like normal, right? So the prevention is the best thing, and prevention not only prevents disease but also prolongs your life, healthier life. It's like, say, I can with struggle from 60 to 70, I can live, but like so much of medicine, so much of treatment. Earlier, our grandfathers used to live till 70, 80, 100. My great grandfather lived for 120 years, 102 years, sorry. And they used to tell that till his last days, he was super healthy. It's not like he was dragged out of his bed and made to live for 100 years. He was healthy. So that is what is missing in the current generation. We are staying, our life expectancy has increased. It's not like I'm super healthy and go up to that stage. I'm like been dragged by all the great treatments possible. So that's what is making expensive healthcare. In US, most of my numbers come from US. 5% people, that very sick 5% people consume nearly 50% of healthcare resources. In the sense, it's so expensive to treat them. And imagine that 50%, even 5% we put on the premium, preventive aspect where we can do this. We don't need that money. It's a waste to put money into healthcare, which is natural for humans. If you can do this.
Very interesting. There would be some fears as well, right? I mean, are you playing God? Are you, if I have a chip in my body which is collecting data, it can also give me some additional kind of capabilities in that sense if I want to talk it. You see any ethical concerns, or are we expediting evolution? People talk about various things, right? So and this human machine kind of boundaries getting blurred. What will that lead to if, what's your take on such concerns that come up?
It's a concern, but I'm speaking from like, I feel it's more ethical to prevent a disease rather than treat a disease when you know like what is causing disease, right? Instead of just letting people do whatever they want, when you know that it's affecting them, and then like say, okay, let them do whatever they want and come to me when they really get sick. At that time, you can't prevent anything. If you have pain, you will go to the hospital. I feel that's more unethical thing than anything else that's happening. Okay, because if there is a technology, if there is a way where which we can really predict like what is happening, what are the things that are happening, and it doesn't cost much to do them. Like many of the precision medicine will be sorted out by very little things like changing your lifestyle, supplement, eating the right food, doing life lifestyle. That's what, most of our traditional knowledge also talks about healthy living. Because if you literally translate Ayurveda, it is healthy living, right? So these things are very ethical. In fact, like not telling people or like not going that way, thinking, okay, there is not much money in preventive medicine, but more money in sickness care, I feel is more unethical. Yeah, when it comes to putting a chip in human and then all the bionic things and all, okay, we don't need to even go there to do this.
Yeah.
It can be done much easier way without like putting it, creating cyborgs. There is technology available today.
Yeah.
Where we can go much deeper than what we do and then understand this.
Yeah.
And there are also external technologies like, all the IoT, these watches, these smart rings and continuous glucose monitors, many technologies which are available already. But the approach has to be different.
Yeah. Very interesting, because you're saying that the technology exists. We can do so much better to improve people's lives, and not for the few. You're saying it can be democratized and go to the last person because the costs are not as much. It's just that we need people who can work on these problem statements, and you're saying education plays a big role.
Exactly.
Particularly at undergrad education. If India can produce this talent, not just for India but for the world, in solving people's health, and health is, so important, as you're saying, right? Not just, on a daily basis, if you're not healthy, there's a challenge, but also economically, it's a challenge for the country, for your families. We have seen this in COVID recently, how many lives got destroyed because of not having this understanding. Another part about your life that I found very interesting, and if you can elaborate a bit, because I have also had a similar journey, that you were at MIT doing your master's and then MBA there, and you had a lot of options to be there because you are at the intellectual capital of the world in that sense, right? And then choosing to come back, right? Why would you choose to do that? Because you will not find problem statements at that level being worked upon in India. So how did you make this transition, and how do you feel about the transition?
It was a very, very well thought out decision. It's not like, okay, I didn't like something there or I couldn't leave. I loved what I was doing in Boston, and the whole intellectual stimulation that comes in staying in a place which is like far ahead of any other place, especially when it comes to biotechnology and healthcare. But I see a huge potential for India in solving world's problem because of two major reasons. One, we have the youngest population on Earth, and who are highly intellectual people. We are not a civilization who is just numbers, but also a very ancient civilization which understands education, who can understand virtually any top technology. If you see all the generative AI work being done across the world, there is a big Indian connection. And that's happening in the West because they are provided those opportunities there and not here. If people can be provided an opportunity here, they will do it here. That's how I felt. And the great thing about India is it's many ways lot easier to do things in India at a scale because of so many people and the vast population and the opportunity that lies here. Few things are not there, but ultimately somebody has to bring that piece and then put it together. Then India can really take up. Otherwise, who would have thought that India would be IT capital kind of thing 20-30 years back? There was nothing like people used to struggle to import one computer in 80s and 70s, and today like we have the highest number of developers in the world. So it's an amazing change that has happened in just one generation. I feel healthcare is world's next biggest problem, which is the next frontier to be solved. And India has the capability to provide nurses, to provide scientists, biotech, everything, because we have that many young population, that many universities at a scale, but they need a kind of direction. And somebody does cutting edge work from India, it becomes right. It becomes an inspiration for someone. If I do it from Boston, imagine I do all this from Boston, how would an Indian student get inspired? They'll think, okay, I have to go to MIT or I have to go to US to do this. But if somebody does it from India, then it means, oh, this can be done in India. Maybe one company at a time, one university at a time, doing something is what pulled me back. Actually, I do all this in India, though we are a US company. I have very good researchers across the world who work on this problem. But if you see, the bulk of the work happens in India. So that makes it a fulcrum of what I'm doing. And this was the thought behind like
Very
coming.
interesting. Because you're saying the world's toughest problems and perhaps the most biggest problem that is emerging can be solved from India. And if we can demonstrate an example that it can be done, it inspires a whole generation of
Yeah.
the young talent that we have here.
Yeah.
In many ways, similar to the Rishihood story. When I was studying abroad, I felt if such institutions can exist there, why can't they exist in India? So let's go back and set up an example that a university like this can be built in India, and that should inspire many more people to build great institutions. So a lot of convergence in thoughts, and I think we will continue this conversation, and I look forward to many collaborations because we are aligned in the same direction. Thank you, Vishnu Vardhan ji, for coming over and sparing your time and sharing these thoughts.
Yeah.
I'm sure it's a spark for many more things to come forward. Thank you.
Yeah. Thank you for calling me. It was great coming to this place. The whole name itself is so inspiring, right? Like Rishihood. I was really amazed when I just heard this name. Like, how did they even come name about it? But this is the change I'm seeing. See, you could have just stayed back in US and then worked for some Google. You came back and thought of doing this. So similar, like you want to do it in education. I thought of doing it in healthcare. But the commonality is, thinking that India is the next place that's going to do a lot of things for the world, not just for India. And that's real. Like if people really bet their lives on it, it means it's happening. It's not just a thought or a dream, but it's turning into reality. Yeah.
Thank you.
Thank you.